Hello cruel world, my name is Dr. Sohom. I'm a consultant forensic psychiatrist. I assess mentally disordered offenders for a living so that you don't have to. Today's video is all about mood swings versus bipolar affective disorder. Now, I've lost count the number of times in my life, both professionally, patients, work colleagues, and also just general day-to-day life, of people saying that they have bipolar or that somebody's bipolar when they actually just mean mood swings. I think it's just a phrase that's often misused, misappropriated, in the same way that sometimes people who are just feeling a bit sad say that they have depression, or sometimes people who are just a bit anal say that they have OCD. I don't have a problem with somebody misusing the phrase if it's just a throwaway comment, but if somebody self-diagnoses when they don't actually have the disorder, then I've got a bit of an issue. I think that's appropriating the disorder, and I think it's a bit disrespectful for people who have the disorder, for example, who go in and out of hospital for many years. So this video is going to cover a range of aspects. I'm going to talk about mood swings, the situations that they occur in, both non-pathological, so for normal everyday life, and also pathological, so that's if it's related to mental illness but not bipolar. And then I'm obviously going to talk about bipolar affective disorder. I will tell you the symptoms, the signs, the behaviours, the treatment. I will answer the question whether somebody has to go to hospital or not. I'm also going to end this video by telling you briefly about a couple of cases of patients that I've seen with bipolar affective disorder, and then I'm going to list some celebrities that have this diagnosis. So sit back, relax, enjoy, and welcome to Psych for Sore Minds. Okay, so mood swings. Well, people can have mood swings as it's part of their natural temperament. It can just be who they are. Or they can have quite chaotic lives with lots of ups and downs. For example, turbulent relationships, both romantic and friendships. They could have a lot of arguments. So that in itself can cause mood swings. Or you can have a particular job that has its ups and downs. So I remember once I saw a trader who was very successful and would make lots of money, but would also lose lots of money, and that really affected his mood. Also drug abuse. So say if you've got a healthy cocaine habit, then obviously using drugs versus coming down off drugs versus craving drugs, having problems getting them, such as lack of funds, that's going to cause a natural fluctuation of your mood from your day-to-day life. So all of those are examples of non-pathological situations where there are mood swings. In terms of pathological situations, borderline personality disorder is associated with mood swings as well as other symptoms such as irritability, explosive arguments, a lack of self-image, and self-harm. I've actually done a video about personality disorders, including why it can be quite harmful to label some people with personality disorders. They are quite a contentious issues. Somewhere else on my channel, go check it out. Also, premenstrual syndrome. So women who go through cycles can also experience mood swings. I'm sure that's probably familiar to some people watching this video. And dementia. So dementia causes confusion, a lack of memory, and it can cause mood swings. And finally, cyclothymia. So cyclothymia is kind of, I suppose, pathologicalizing the natural tendency to have mood swings. So it's when people experience up and downs, but the ups are not quite high enough to be mania, which I will describe soon, and the downs are not quite low enough to be depression. That is cyclothymia. So bipolar affective disorder is a serious mental illness. The incidence is roughly the same between men and women, and it affects about 1% of the global population. And this is basically very extreme mood swings. So the patient has periods of depression, periods of euthymia, which is a normal mood, and periods of mania, which is an elevated mood. So depression, we all know what depression is. Depression is low mood, a lack of energy, lack of motivation, and a lack of pleasure in activities. Euthymia, which is normal mood, is how most of us are most of the time. And mania is like the opposite of depression. So it's periods of feeling overexcited, very happy, or very irritable. People tend to have a flight of ideas, so lots and lots of ideas. They start new plans without finishing them. They can be speeded up in their thinking. They can be speeded up in the way that they speak. They can eat loads. They can feel full of energy despite not feeling they need any sleep. They can also be quite grandiose, so they're really feeling themselves, and some of their acts can be disinhibited. So they might do things that they wouldn't do when they were euthymic. Sometimes that can cause problems or it can cause embarrassment. So off the top of my head, I've seen patients who gamble way more than they would have done normally. I've seen a man who was walking around topless for a couple of days in his neighborhood. I've seen another man who is making declarations of love to people that he was working with. And they can also be quite impulsive, so they can commit acts like spending money, sexual promiscuity, stuff that they might regret later. I've actually done an interview with a lovely woman called 𝐏𝐬𝐲𝐜𝐡, which is somewhere on this channel. She suffers from this disorder and she talked me through what it actually feels like. So I can only talk about what it looks like. People who've lived it can actually tell us all about the experience so we can learn from them. And another symptom of bipolar affective disorder is a lack of insight. So when people are in these phases, especially mania, they don't know that they're in these phases because everything feels good to them. They have no drive to want any of this feeling to stop, which can be a problem because it means they might not want to seek medical help, including medication. So what are the causes of mania? Well, like most things in psychiatry, there isn't just one simple cause, it's multifactorial. They say that about 80% of it is genetics. So it's not just one gene that you inherit, but it's a cluster of genes that tends to run in families. So what that basically means is that if you have family members with this disorder, that doesn't by any means necessarily mean that you will develop this disorder, but it will increase the chance of that happening. And there are external factors like, for example, if you suffer from childhood abuse or if you have a lot of long-term stress, that will increase your chances of developing this disorder. Bipolar affective disorder comes in type 1 and type 2. So type 1 is where you've had at least one full-blown episode of mania. Generally, it comes and goes and relapses over time, but to have this diagnosis, you have to have at least one, whereas type 2 can be seen like a milder form of bipolar. So you don't quite go into mania, you go into hypomania, which is similar in that your mood's raised and you have the same kind of symptoms and behaviours, but crucially, you can still function. So you can still hold down a job, you can still live your normal life. You don't, for example, need to go to hospital. I've actually done a video on Kanye West, and if you watch that video, you will see that I argue that it's difficult to know what is hypomania versus mania for Kanye because he's so wild and outlandish, and he's allowed to be in his role as a superstar rapper that the threshold for his level of functioning to decline is, I think, very unclear. Go check out the video. What are the treatments for bipolar affective disorder? Well, the main type is a mood stabilizer. So lithium or sodium valproate are probably the two that you might have heard of. You can give people antipsychotics that act as mood stabilizers if they're really unwell, if they become psychotic as well as becoming manic, or if they're extremely aggressive, although we try and stay away from them because they are not healthy medicines to take in the long term. If somebody's in a depressive phase of bipolar affective disorder, you can give them antidepressants, but you have to be careful because giving them too much can actually flip them into mania. I've seen this happen quite quickly and it can be very damaging, so you have to be really careful as a psychiatrist. So the next interesting question is, do you need to go to hospital if you have bipolar affective disorder? And that really depends on your presentation and your level of risk. So if you're hypomanic, if you're able to function, then you probably don't have to go to hospital. However, if there are risks, if you're being aggressive towards somebody due to being disinhibited, or if you're saying things or doing things that might lead to some sort of retaliation, then the psychiatrist might feel that you're not safe to be in the community until you get better. Crucially, insight in taking medications is a big part of this. So either you've got the insight, which is unusual, or family members or friends have convinced you to take medication, then the chances are you will get better relatively quickly and won't need hospital. Versus somebody who absolutely refuses to take medication, who might need to be medicated against their will, therefore they definitely will need to be sectioned. So I'm going to talk briefly about 2 cases of bipolar affective disorder that I've seen. I'm not going to do a deep dive as I do in some of my other videos because it would just be too long. I'm going to give you a quick overview. The first man I saw was in his early 30s. This was in a clinic when I was a specialist registrar about 8 years ago. He was a graphic designer, he was a handsome man, he was in a relationship, he was quite successful. And he would have a relapse about twice a year. So he would do some disinhibited things. For example, he would text message people, sometimes people had not been in contact for years, and he would kind of cause issues. He would break down arguments or disagreements they had in the past in forensic detail in these massive messages. He once phoned an ex-girlfriend from over a decade ago who is married at that point and kind of broke down why their relationship ended in detail, which kind of freaked her out, angered her husband. He also made some odd comments to clients that he worked with. So he would phone them up and give them some unusual advice, like trying to tell them that they had anger management problems or had confidence issues, tried to convince one random person that he needed to go to meditation classes. So this caused a problem with the reputation of the company he worked for. So as you can see, his actions affected his life, but they weren't dangerous, they weren't risky. He didn't need hospitalization. Luckily, even though he didn't have insight, he was very open to listening to his girlfriend, who convinced him to take higher doses of mood stabilizing medication each time he would get better within a few weeks, and he would carry on with his ordinary life. The people around him were very understanding and very accepting, so this is a happy case. I would contrast this with another case that really stands out in my memory. So this was when I was working as a consultant in a secure psychiatric unit that looked after mentally disordered offenders in Essex. And this man was in his 50s. His index offence, so the reason he got arrested, sent to prison and eventually to a hospital, was because he smashed up this bar in Surrey. He hadn't slept for 3 days, he was manic, he was also a bit drunk. He was just throwing bottles behind the bar, caused loads of damage, had a bit of a standoff with the police. When he was on the ward, his mood varied wildly. So on some days he was really pleasant, jovial, he was quite funny actually, he would make me laugh. He would dance around with the nurses and was just a pleasure to be around. On other days, he was really angry and really agitated, quite threatening. He had some paranoid delusions, including that I was trying to kill him with the medication I was giving him, so he would become quite aggressive and threatening towards me. He would not listen to any boundaries, so if he was told no by a nurse, even for something quite small, like he was spending too much money on takeaways for other people, even if somebody said politely that he might want to look at his money situation because he was broke, this man would become enraged. He assaulted a couple of nurses, he pushed over some people, he punched a patient once, knocked out his teeth. So this was a sad story of a man with a treatment-resistant bipolar affective disorder. He needed to stay in hospital for the long term. He needed to be medicated against his will. So I've chosen those two cases to show you the kind of extreme ends of the spectrum. So before I finish, I'm going to briefly name some famous people that have bipolar affective disorder. The reason I'm doing this is because I'm hoping to kind of normalize it and to make it feel less stigmatized and less of a taboo subject. So if you or somebody you know is suffering from disorder, I want you to see that that doesn't mean that you can't be very successful and you can't live a happy and well-motivated life. All these people, by the way, are obviously out in the public domain, and several of them have talked about their experiences. I'd encourage you to go and listen to their stories. You can find them quite easily on the internet. So these people are Kurt Cobain, who tragically committed suicide in 1994, age of 27, Mariah Carey, world famous singer, Russell Brand, comedian, Jimi Hendrix, one of the best guitar players of all time, who also coincidentally died at the age of 27, and Frank Sinatra. So to conclude, bipolar affective disorder is not just mood swings, it's so much more. It can be a very debilitating mental illness. Some people can function very well with it, some people really struggle and need to go to hospital, need to be medicated. I think it's also fair to say that some people with bipolar can be very creative, and some people have even said that it's whilst they're in these hypomanic or manic states that they have this energy, motivation and creative drive to be successful. I don't think that can be understated. I don't think it's right to call just mood swings bipolar because, as I've explained in this video, they're very different. So this is my video. I hope it's been educational and entertaining for you. If you have any questions, please leave them in the comments below. Please check out my channel. I have a range of videos about a whole host of mental health issues, individual diagnoses. Some of my videos are in relation to true crime because that's the area I work in as a consultant forensic psychiatrist, and some of them are more common to the average person, like this video. Okay, that's enough from me. Stay euthymic, and please do not forget, I love you.